This series of videos was designed to provide educational content for federally qualified health centers and rural health clinics to assist with their telehealth implementation. The content is also useful for other types of providers and organizations.
Welcome to this video series on teledentistry, developed in partnership with the National Network for Oral Health Access and the Mid-Atlantic Telehealth Resource Center. Teledentistry is an emerging field using technology to improve access to oral health care, improve efficiency, and address inequities in oral health access and outcomes by bringing care to where people live, work, and play. In this video series, we will cover what is teledentistry and how it is being applied in safety net settings. In the second video, we will share the benefits of teledentistry and how it helps patients. And the third and final video will cover promising practices and resources to help you get started using teledentistry. Through this video series, you will learn that teledentistry is part of a larger, comprehensive system of care. Teledentistry is an equity practice and an effective way to increase access to care by reducing barriers to care due to distance or transportation or other barriers. And teledentistry improves outcomes for patients and providers. This video will give you a strong understanding of the current state of teledentistry and help you consider future possibilities in the field. What is teledentistry? Teledentistry is the use of communication and information technologies to provide dental health care to populations. Often, teledentistry aims to provide these services where it may be otherwise inefficient or impossible to provide traditional dental care. The term teledentistry encompasses multiple applications, methodologies, and developing technologies. Investment in teledentistry is growing and the field is advancing rapidly. At its core, teledentistry is a tool to deliver oral health services as part of a comprehensive system where everyone gets the support they need to attain their full health potential. Teledentistry does not replace traditional in-person dental care modalities, but rather it seeks to enhance and support. It can also provide care to otherwise unreachable populations. Some key terms of teledentistry include synchronous teledentistry, asynchronous, which is also known as store and forward teledentistry, remote patient monitoring, and mobile health. Synchronous teledentistry is any live, two-way interaction between patients and providers using audiovisual telecommunications technology. Asynchronous, also called store and forward teledentistry, refers to the transmission of historical health information, such as radiographs, photographs, or video, through a secure electronic communication system. Remote patient monitoring refers to personal health and dental data collected from a patient in one location via electronic communication technologies, which is transmitted to a provider, sometimes via a data processing center, in a different location to use for care planning, management, or support. And mobile health refers to more general healthcare, public health practices, and education supported by mobile communication devices such as smartphones, tablets, and other devices. Community health centers are using both synchronous and asynchronous teledentistry to deliver patient care. Synchronous teledentistry is any real-time virtual interaction between a patient and a provider. The provider and the patient are remotely located and will use audiovisual telecommunications technology such as smartphones, tablets, or computers to have face-to-face interactions. For example, a patient may be able to talk with her dentist about her latest x-rays from the comfort of her own home via a secure telecommunication system. Here's a quick scenario to highlight how it works.
One instance that comes to mind when I talk about that is we had a special needs patient who was located almost 3 hours away, and they'd gone to multiple emergency rooms because he was hitting the side of his face, he wasn't really eating well, he was having different behaviors, and really just not found a solution as to what was going on. There was no extra oral swelling, so nobody was able to tell them what was going on and give them a definitive solution. They were referred to our clinic, so we decided to do a teledentistry visit for them. At that visit, we helped coach mom on how to do an exam so that we were able to look in the mouth. And we were actually able to identify the offending tooth and get a plan on how to proceed with treatment and get everything set up for them to do the travel of 3 hours and get the treatment done. The parents were very, very grateful. And of course, the patient was relieved of the pain, and we saw an instant change in behaviors with the patient. So I think that was a really heartwarming and great experience with our teledentistry program.
Another scenario. Jasmine is 3 years old. Her pediatrician reminded her mother to schedule a dental appointment for Jasmine. She contacted the health center dental clinic for an appointment, and they offered a teledentistry appointment, where Jasmine could be at home for the visit. The clinic mailed a pre-visit packet that included a toothbrush, toothpaste, fluoride varnish, patient education materials, and instructions for taking photos of Jasmine's teeth. The morning of the appointment, the clinic texted a link to the teledentistry appointment. Jasmine and her mom logged on at the appointed time, using the mom's cell phone in the kitchen of their home. At the appointment, the dental assistant completed the health history and conducted a risk assessment and helped the family set a self-management goal. The dentist then joined the appointment and asked if the mom had any concerns. The dentist reviewed Jasmine's health history and looked at Jasmine's tooth chart with the mom while projecting the tooth chart on the screen. The mom then demonstrated how she brushes Jasmine's teeth, and the dentist gave some pointers and tips to try. Then the mom painted fluoride varnish on Jasmine's teeth. Jasmine left the visit, and the dentist discussed the follow-up visit with the mom, and the dental assistant scheduled the next appointment in 6 months in the clinic. Asynchronous teledentistry simply refers to providing information or evaluation outside of real-time interactions. Asynchronous teledentistry deploys dental hygienists to community settings where people live, work, and play, reserving the dental operatory only those patients who require the specialized services that can only be delivered in a dental operatory. Here's one example of how it works in an asynchronous model. Betty, a licensed dental hygienist, goes to the same local senior living facility every Monday. She collects a full set of electronic dental records as allowed by state regulations where the facility is located. These records include radiographs, photographs, charting of dental conditions, health history, consent, and applicable progress notes for the patient. She stores information that is later forwarded to the dentist via a secure HIPAA-compliant connection that uses encryption technology. Later, the dentist completes a comprehensive oral examination, diagnosis, and treatment plan from their computer. As we can see in this scenario, the patient only interacts with Betty. Betty collects all the information, and she delivers all the documents to the dentist for diagnosis, evaluation, and treatment planning at a later time and location. The dentist has no live vocal or visual interaction with the patient or the dental hygienist during information collection.
This series of videos is presented to you by the National Consortium of Telehealth Resource Centers, the NCTRC. The NCTRC is funded through the U.S. Department of Health and Human Services, the Health Resources and Services Administration, and the Office for the Advancement of Telehealth. This map represents the NCTRC, which covers the whole United States and includes 12 regional TRCs and 2 national TRCs, which are the National Policy TRC and the Telehealth Technology Assessment Center. The TRCs have been in existence since the early 90s and were established to provide assistance, education, and information to organizations and individuals seeking information on providing healthcare at a distance. The NCTRC mission is to expand availability of healthcare to underserved populations through telehealth. For more information about telehealth, the NCTRC, one of the 2 national TRCs, or your regional telehealth resource center, please contact us through the NCTRC website. Thank you for joining us in reviewing this video series.